And we appreciate that Zoom has added that feature, so it does make people aware that it is being recorded. And just Bristol's Promise, we did a recording policy not too long ago to be sure that we follow good principles for choosing to record. So welcome to folks, and welcome as people are coming in. And I'm Margaret Firerobin, and I work with Bristol's Promise and also work closely with Family Promise of Bristol. And both of those and many of our groups are very much learning about and aware of adverse childhood experiences and trauma and what that can do to people's lives. So that brings a lot of us together to support families, support individuals, and try to help make our community a better place. So real quickly, what we wanted to do with this meeting, we met in December. We had hoped to follow up in January. We did not do that. So we apologize, but we're meeting now and wanted to just give opportunity to provide more information. Recognize that our disease numbers are down, but we're not done yet. So wanted to give opportunity for our health leadership to remind us of that and give us good information. We also wanted to have opportunity for the faith community to recognize what their role continues to be. And we've got Lisa Kofer, who's going to do an overview of some of what we're seeing in our community for after effects of COVID and currently what continues. And we're going to touch on what resources are available. And there are a lot of folks on here who come with community resources, trying to help our congregations and faith community know that there's lots of help out there for your folks in your congregation and also folks who may come to you asking for help. And then we'll do any planning for follow-up from this. So with that, we're going to have we had hoped to have both our health departments. We understand that Mount Rogers had a last minute, this conflicts anyway with a meeting that they have, but they have sent an update that Melissa Roberts will give. And Dr. May is here from Sullivan County, and maybe we'll start with Dr. May and then follow with the Mount Rogers update. Does that sound okay, Melissa? And then Lisa Kofer will, from our United Way director, they take many phone calls, and she'll give us just a picture of what some of those requests are for help and what they're seeing. We have Bill Hartley, who's mayor of Bristol, Virginia. Malin Luttrell, Tennessee's mayor, was unable to be here. And then we're very pleased to have Mark Cruz from the Accountable Care community working to really improve the lives and so helping us to work together as a region, where he's new as of March this year. So we want to welcome him and help y'all to learn more about what his role and what we're all working together to do. And then Eric Fields from the Summit Companies was unable to be here. Melissa Roberts has worked with Eric and his group to work on the website servingtricities.org, which is a great resource for our community members. So we wanted to be sure that y'all know about that. So if anybody has questions during the meeting, put them in chat, and then we hope to have time at the end for questions, comments, discussion, etc. So that's the format that we thought could be helpful. And with that, I am thrilled to welcome Dr. Stephen May from the Sullivan County Health Department. And I hope that they have been able to have a few nights sleep since things are slowed down a little bit. They may have the time to sleep. I know some of the health officials aren't having good night's sleeps because of what they're worried about. So Dr. May, if you want to give us a little bit of an update, that would be fantastic.
That was great. Is great, and thank you so much for having me here. It's always a pleasure to get to speak to y'all. I thought I would go over first what is our current status and where are we with the actual disease state. I'll talk a little bit about the Delta agent. Talk about our vaccination status, vaccination availability, and then review any current guidelines and safety practices that we still should have in place for the community. So looking at our disease status, Sullivan County continues to have decreasing rates. We're down to averaging about 4.5 cases per day on average, or 2.4 cases per 100,000, which is well below the 5 that we say that the disease is under fair control. We continue to do testing. Our positivity rate is about 3.7%, compared to the state rate of about 2.3%, and Ballad's rate is about 3%. The hospital situation remains under fairly good control as far as number of cases of disease and people on ventilators. We still, though, do have people who are dying and get critically ill and wind up in the hospital, but not near the numbers like 350 that we had back in December. At one time, I think they're down to about 30 or so cases that they have in the hospital throughout Ballad for right now. Now, looking at uh, uh, our numbers, we've had confirmed about 17,000 cases. We're down to about 32 of those cases that are active right now, which is a very low number. We've had 310 deaths, and we now, through the CDC, consider basically any death from COVID, since it's now moving into a preventable disease with vaccine, as any death is unnecessary now with the availability of vaccine. Moving on into vaccine, we've given out about 124,000 doses in Sullivan County. 42% of the population has received at least one dose, and 39% has gotten 2 doses. But our vaccine campaign is stagnating somewhat. We matched the state around 42 and 37% respectively, though. In our own little health department, we've given out over 56,000 doses since vaccine became available in late January. Now, when we talk about the effectiveness of the vaccine, we've only identified 83 cases of breakthrough out of all those 125,000 shots that we've given. Very few have wound up in the hospital, and no deaths in the vaccinated group, which is important. The other is our ages over 50. We are doing better at getting vaccines into those age group. Those over 70, we vaccinated over 78%, 65 is 61%. But as we go down, we see less and less involvement with the vaccines. Now, the reason that the vaccine campaign is so important right now is we're in a race. We're in a race between the Delta agent right now and the vaccines. With the vaccines, with 2 vaccines of the messenger RNA vaccines, we know that we can protect over 90% from from even getting ill, and virtually 100% we can protect from hospitalization and death with the vaccine. And so these vaccines are so important, especially to those who are at high risk. Now, Delta agent is a new strain. It began in India during the massive surge that they had there. And it has subsequently moved worldwide. United Kingdom is currently in the thick of it, with greater than 95% of cases now being caused by the Delta agent. The Delta agent is twice as infective as the United Kingdom strain, which was twice as infective as the wild strain or the Wuhan strain. So we are concerned about this one. The symptoms are a little bit different. We tend to see more headache, sore throat and runny nose with it, which is not what we typically saw with the original strain. Also, we're seeing 2 times the number of hospitalizations associated with this strain. So it has reached the United States. We are tracking it more in the Midwest and the western regions of the state. Arkansas has about 44% of its strains as identified as Delta agent. We know that this strain, once it hits a region, doubles about every 2 weeks. So we know if Arkansas's got 44%, they'll be basically 100% in the next 2 to 3 weeks. And we are starting to see some cases in West Tennessee identified as the Delta agent. So we're anticipating probably in 6 to 8 weeks, about the perfect time when school's hitting, a lot of things going on, rhythm and roots. We're going to be having the Bristol races, a lot of activities going on where people will be mingling with this highly infectious virus that's available. So my message is we need to get people vaccinated. We are now vaccinating anyone over the age of 12 with vaccine. The other thing is, in an effort to make it easier for access to vaccine, we can provide, if you have somebody who's homebound, special needs that cannot get out, we have a strike team that is willing to take their name and number and go out and personally provide a vaccine in their home. So that's one thing that we're doing right now. Also, we have strike teams that are willing to go with any group that would like to have them attend, come and talk about the vaccine, and then be able to directly provide that vaccine. We've been reaching out to businesses, industries, churches. So anyone that would like to have vaccine brought to your facility and provided, and we're doing this essentially almost 7 days a week now to anyone that would like to have it. You can call our health department at 423-279-2777. Tell them you'd like to set up a vaccine strike team visit, and they'll get you to the right people. So the final thing that I'll bring up, other than talking about the vaccines, is there's been a lot of questions on the guidelines, the safety guidelines, and with Delta agent moving in, schools coming back into session, all this other socialization that's wonderful to have, there are still cautions out there. If you have not had the vaccine, then you should continue with those types of safety measures. That includes wearing a mask out in public. That includes trying to keep your 6-foot distancing. Now, if you're vaccinated, they pretty much drop most of the mask guidelines unless you are immunocompromised and may not have developed a great immunity to the vaccines that we've got. So that's kind of a quick update on what our numbers are in great shape right now. I'm so excited to be able to go home and not have to worry about it. We do have to watch for the Delta strain. I anticipate it to move through probably in 6 to 8 weeks. We may see a bump in our numbers of cases, hospitalizations, and death at that time, but it is completely 100% 90+% preventable by just getting the vaccines. And otherwise, those are the guidelines that I've gone over. So if y'all have any questions for me, I'll be glad to try to answer them.
Hey, I haven't seen any questions in the chat. Does anybody have anything they want to specifically ask Dr. May? Yes, Patty Caldwell.
Would you repeat that phone number, please?
It's 423-279-2777.
Thank you. I do Meals on Wheels, and one of the ladies said she hadn't been able to get the vaccine. So now I know that you will come to her house.
Absolutely. We'll be delighted to come. Those are the ones that are the greatest risk, that we truly want to get the vaccine in their arm Those who are immunocompromised may not be able to get out, tend to be more sickly. We really want to get the vaccine to them because the vaccine is life-saving.
Thank you. Anybody else? Tammy Alls.
So Dr. Mayer, did I hear you say that you, like, maybe you would appreciate some of our groups out here in our community to have some pop-up vaccine events?
Oh, absolutely. We can schedule those and work with our strike team. They bring everything that you need to an event. We just kind of need to know about how many want the vaccine, and we will bring it out in our ultra cold coolers and, give it in a safe fashion.
No, I should say that was Tammy Alls from YWCA, and I see Dan Gray from Adeline United Methodist has his hand up. Dan.
Yeah, thank you, Margaret. Thank you, Dr. May. Question about churches gathering back in person. We are following CDC, asking folks who are unvaccinated to wear masks in worship. For vaccinated persons, we're leaving that optional. But a particular question about choirs. In the past, I've heard distancing of 15 feet, keep it to a minimal. Has that changed? What would you recommend? Can you get a choir back together, 15 feet, 6 feet?
I think you can certainly, particularly if the entire choir is vaccinated, then I think they can actually remove their mask if the entire choir is vaccinated. Now, if you've got people that you just don't know what their status is, then you're better to leave everybody in mask and continue the distancing. And that is the CDC guidelines for that.
Okay. Anybody else? Okay. Melissa, if you will hold your update, Lisa Kofer, I think, has another Zoom meeting coming up. So we'll switch to Lisa for just a little bit about what they're seeing, and then we'll get a little more update from Southwest Virginia. So Lisa.
Thank you. Good morning, everyone. Thanks so much, Margaret and Melissa, for putting this together. And hi, Dan Gray. I guess I'm going to see you every day this week, and that'll be a blessing. Just wanted to give you all some updates on the calls that we are receiving. This is February through June, and it's actually a few more than what I'm going to report because we got some more calls yesterday, but we have received 286 calls. 30% of those are from homeless folks who need emergency shelter, who are trying to get into some sort of permanent housing. As you all know, we have a very limited amount of affordable housing in our community in both Bristol, Virginia and Bristol, Tennessee. So it is a huge struggle, and I'll talk a little bit more about that in just a minute. 38% of those calls are for assistance with their electric bill. As you all may or may not know, we are administering the COVID CARES dollars for both the city of Bristol, Virginia and the city of Bristol, Tennessee. We can pay up to 3 months and a maximum of $1,000 for electric, and then $250 towards food for families that have been impacted by COVID. So they do have to be able to show proof that they've either had COVID, they had a loss of a job due to COVID, those kinds of things. But we are being bombarded, especially in the last week or so, with folks needing help and assistance through that program. It does take some time to get all that paperwork together. So if you share that opportunity with folks, tell them that they need to go to unitedwaybristol.org, and they'll be able to click on help and be able to go ahead and fill out the application and look at what kind of paperwork they need to get to us, because it's taking 2 and 3 weeks to get everything in, and we want to move those through as quickly as possible. 38% or 12% of the calls are for assistance with rent. 8% are other, which could be a bus ticket. It could be other things that folks are calling us about, dental work, those kinds of things. 2% transportation, and 1% for food, which is not surprising to us. We have been working with the Bristol Emergency Food Pantry especially during COVID, to make sure that our families, that the pantry is stocked and that our families have what they need. And it seems like food is not at the top of the list. A lot of that, I'm sure, is because of the stimulus dollars and other funds that folks have been able to get help with during this time. And Lynn may talk a little bit more about this later on, I don't know, but several of you all have heard us talk about the home program. This is something that is a partnership with the Envision Center with Bristol Redevelopment Housing Authority. Very excited about it. Had our first meeting 2 weeks ago, scheduled to meet again next week. And what this program will do, provided we have some financial support, which we're working on right now, it will help us to work with landlords to be able to pay up to a certain number of months for folks to get them into housing. These are folks that are primarily our Alice families, those that are working, that are asset limited, income constrained, but employed, and helping them hopefully move from being homeless or living in a motel into something more permanent, and to give them, wrap those services around them for a longer period of time, to be able to help them become stable. So we're very excited about that program, and reaching out and doing some things to get some funding for that. But right now, that's what we're seeing. We're trying to send those that we can't help with, that are not calling about electricity, to the Envision Center for their amazing case management services, and be able to wrap those services for other things around our families. So I'm happy to entertain any questions, but that's what we're seeing right now.
And I would add to that, for the Tennessee side, Family Promises grant for housing and doing some of that rental assistance as well.
Is that already, is that in, I mean, are you all able to do that now, Margaret? Okay. I guess I need to talk to somebody then and get an update so we know kind of.
Right. Yep. Yeah, we'll follow up with that.
Okay, great.
Okay, anybody have questions for Lisa? So while we're following up with her, just a couple of things. One is, Melissa, if you can put in the link for Alice, that would be great. So Lisa mentioned the Alice reports, which are United Way, began several years ago, but helping us to look at our community. And in our combined community, we are approaching 50% of folks who are either living in poverty or are classified as the Alice, which is asset limited,
income constrained,
employed, as Lisa said. So those are more of our working poor who go paycheck to paycheck, and a car repair or a medical bill or something unplanned can put them over the edge. So for us to really understand our community and know that that's a lot of people in our community that need our support in all different kinds. Yeah, Lisa.
Well, and I'd just like to mention a lot of the folks that we are working with. In fact, yesterday, there was a gentleman sitting in our lobby when I got here yesterday needing assistance. And, you know, we do have a lot of Alice families, those folks that Margaret mentioned that are working really hard. Some of them are working 2 and 3 jobs just to keep food on the table and pay their rent and, you know, the bills that they have. And it can just take one medical bill, one, you know, car repairs, Margaret said, to kind of knock them off track and to cause a spiral out of control for the family. So we work really hard to try to help those families have what they need in those instances when we can. But we are also seeing a lot of folks that are not working. And, you know, they've got to work. You know, I know that a lot of these families have a lot of issues going on, and we try to, you know, get them connected with mental health services and other, you know, resources that are available. But, you know, they've got to work, and people are desperate to hire. Robinette Company, just in case you all didn't know, they are paying $1,000 sign-on bonus and $13.50 an hour, and are desperate for employees. And almost anywhere you go, drive down the Volunteer Parkway, State Street, wherever, you will see signs for help wanted. And so if we can connect these folks And it might not be a job that will help them, you know, do everything that they need to do. But if we can get them employed, then we can help provide some other resources, get them connected with, you know, training programs and other educational opportunities that will help them be able to be in a better position to get even a better job. But we've got to get them working in order to know, you know, what all they need. So anyway, I've got to run, and thank you so much for giving me the time, Margaret. I appreciate it. And Melissa, thank you, everyone. And I guess I will see you later.
Right, thank you. So, and we'll come back to some of our needs and resources in a few minutes. Melissa, if you want to provide us with Mount Rogers update, since they were unable to join us today.
Sure. They apologized for not being able to be here, but they had something major come up. They are doing mobile vaccine clinics through August with associated outreach, and they'll reevaluate that in the fall while continuing outreach at large events. Vaccines are available at all of the local health departments throughout the Mount Rogers district. They, much like Sullivan County, are concerned about the impact of the Delta variant, the impact that might have on our region, especially with our low rates of coverage and vaccination. So they're imploring partners to encourage communities to get vaccinated this summer while the cases are low before those potentially go up in the fall. They anticipate that there may be an increase in cases in the fall if those vaccination rates remain low. And vaccination protects those too young to be vaccinated or those who can't be vaccinated for health reasons. So you can always reach out to Mount Rogers Health District to get your vaccination scheduled. And they're working very, very hard, just like Sullivan County, to make sure that that happens. They're also doing local groups. So if you are on the Virginia side and you want to do a vaccination clinic at your church, at your organization, you can reach out to Mount Rogers Health District and they will schedule that.
Okay, so does anybody, Melissa is not the expert. She is the messenger, but also Dr. May is still online. Anybody thought of any other questions for our health folks or any comments? If not, yes, go ahead.
Hi, my name is Jessica Harbin, and I actually book the mobile COVID-19 vaccine clinics for the Mount Rogers Health District. So I'll put my information in the chat. Yeah, so I'll put my information in the chat, and you can reach out to me if you want us to come to your organization, or if you want us to come. My counterpartner, Mariah Evans, does the outreach. And we can definitely set up to where we can even have Q&As if there's sections of the community that still have questions or are wanting more information on the vaccine. Because just like with Sullivan County, you know, our goal is to help protect our community in any way possible. And whether that's to start with education or if that's to make vaccine even more accessible, then we will do that for sure.
Thank you very much, and thanks for jumping in. I appreciate your being here. Yeah, so the message is that I think our health departments will do just about anything, go anywhere. If somebody has a new idea for some kind of different thing, call them. They're open, I think, to trying any different way to reach people. I don't know that they'll do that they've gotten into TikTok or come and do a song and a dance for your congregation, but they might just even get to that. Chris Aaron, you have your hand up if you, First Baptist Church, if you want to speak.
Sure. All I wanted to say is that we recently had Mount Rogers come out. I spoke with Jessica. Hey, Jessica. Very, very easy to do, extremely easy to work with, a really painless process, really easy to get them to come out. So we had a great experience. I just wanted to affirm that in case anybody else is interested or thinking about it. Thank you.
Great. Thank you. So, all right. If there are no other, and people can jump in with a question at any point.
I have a question.
Yes.
This is Tammy again, YWCA. Okay, so if I'm just trying to think about like who has done a pop-up event, and if you're having to kind of guesstimate how many vaccines you should have, does anybody have any numbers? Like how many come out? Like I know Hope has done a couple in Kingsport, and so I don't know like how many folks are really showing up to get a vaccine if it's a pop-up.
Amy, we did 2 here at the Housing Authority, one at Edgemont Tower and one at Fort Shelby Tower. Sullivan County came out. Thank you, Dr. Mays. We had a strike team come out, and we had about 23 at each building. A lot of our folks had already been vaccinated, but for those that are not able, that do not drive, they were so appreciative that someone came to them and they were able to get the vaccination. So they were awesome to work with at the health department, Sullivan County. And we were just really excited that the residents had that opportunity. So.
Okay, thank you. And thanks for setting that up. So Dr. May, Jessica, do y'all want to answer? I assume it varies greatly.
We will go any place that anybody says they have a group of people that wants to come. We've been to a couple of industries that we only had 4 or 5 that got vaccinated. It's nice to have at least 5 because we know that there's that many in a vial, and we like to try to not waste any out of the vial. But at this point in time, if somebody needs a vaccine, we need to crack a vial, we will crack a vial and shoot them. We have plenty of vaccine available, both of the Pfizer and the J&J vaccine.
Okay, Jessica.
The vaccine is nice in that it's only 1 dose. But the Pfizer is the only one that is indicated between 12 and 18.
Okay, Jessica, you want to add to that?
Sure, yeah. So in the Mount Rogers Health District, really it varies. We've gone places and maybe we don't give anyone a vaccine, but we're able to use that as an education opportunity to talk to people that may have questions. Or we've gone to places and we've done 100 vaccines. So it really varies for us. It's just about getting into our community, being able to offer it, just like it sounds like with the Tennessee counterpart there. To be able to offer it, if we get 1, then that's a great day. So yeah, luckily for us too, if we were to need more vaccine at an event, we're always close enough to one of our health departments in our health district that we could always get more vaccine. So that's never an issue.
Great. And I know a lot of folks who are on here do events, and over time, I think probably most of us recognize benefits of events are also that educational piece. Just the PR and keeping it out there in front of people serves a purpose as well, even if it isn't what we would hope it would be. So that part's good. Okay, anybody else yet right now?
The comment I'll make is you can also schedule an appointment at either of our health department facilities here in Sullivan County. So we'll either go to you or you can come to us, but the short of the story is get a vaccine.
I like that. My schedule doesn't allow sometimes waiting around like at the racetrack for 5 and 6 hours. So I like that appointment part. So that's great to be able to have that. So, okay. We have Bill Hartley, are you here somewhere? And we were going to set you up and I didn't get back with you on that.
I'm here, Margaret.
Yeah, do you have anything from city aspect as mayor to add to the discussion?
No, I'll just say, basically, I appreciate everything everybody's doing. Dr. May, Sullivan County, and Dr. Shelton in Mount Rogers, particularly getting the vaccine helps keep our community safe. A lot of community partners that we work with, particularly with the funding we receive from the federal government to help meet needs, whether it be housing or different things. And then, of course, I appreciate all that the faith community does and is doing, because as people move through the pandemic and hopefully brighter times are ahead, while there are physical needs, there's still emotional and spiritual needs that the faith community definitely needs to meet and can address in our community. So thank you for the work that everybody's doing.
Thank you, Bill, very much. And I think good point for the faith and spiritual needs that certainly during this time, during crisis and following that, there are a lot of losses that people felt in many, many different ways. So appreciate what our faith community does with support of community members.
Margaret?
Yes.
Margaret, can I stick something in here while we're talking about the city? I put in the chat.
Who are you?
I'm Lynn. I'm Lynn.
With the Bristol Housing and the Envision Center.
That would be me. Okay, I put in the chat the phone number for the Envision Center. The Envision Center is partnered with the city to spend their COVID dollars for rent relief. And so we have money for rent and mortgage relief, which is different right now from the state. That's only rental relief. And so we are able to spend rent and mortgage relief for those who have been directly affected by COVID. So I put the phone number in there. You can call and get an appointment to make that application for those dollars if you need that help or know someone, have someone in your congregation or sphere or friend or whatever that could need that help.
All right, and that's Bristol, Virginia, and I will ask either Melissa or Sam Ferguson or Dottie or somebody to put the Family Promise telephone number in as well for the help that is coming through Tennessee housing for Tennessee folks that we don't have the city dollars that are flexible like Bristol, Virginia has, but we have state and federal dollars that help with some of the rent, et cetera. So anyway, yeah, so Mayor Malin Luttrell would probably echo Mayor Hartley. Also, we are grateful for Sullivan County Health Department, and I think Dr. May is going to leave us in a second, but on Fridays, I think still weekly, is that correct, Dr. May, that the Sullivan County Mayor leadership meets with our health department, and they also meet with school system regularly to try to continue to stay on top of things. So that is very helpful. Is that correct, Dr. May?
Yes, ma'am. We meet every week with the mayors and discuss the ongoing topics and needs associated with the pandemic.
Yeah, and that's covered where the different offerings for services are and sharing PR resources to get the words out, et cetera. So we really appreciate that. So next we wanted to talk a little bit about resources for recovery, for building and rebuilding resilience in our community. And with that, we have asked, Bristol's Promise works with the accountable care community and with Ballad Population Health with a grant we have. And we wanted to ask Mark Cruz to talk a little bit about the accountable care community, the resources that are being developed and provided, and just give us a little bit of an overview and welcome him to our community. He is a Southwest Virginia native, and he has come home. So we really appreciate his joining us here in our area. So.
Thank you so much, Margaret. Good
Wait, this is a group, I should say. He also has a divinity degree. So he has that background as well. So we're glad to have you here.
Absolutely. Yes, indeed. Thank you so much, Margaret. And I appreciate you mentioning that. And I hope that that you'll invite me to attend future meetings of this group because it's very important to me personally as well as professionally to connect with the faith community around these important health issues. And having spent the past 25 plus years, much of it connecting faith and health and spirituality, I'm very interested in everything that's happening in our region that involves faith and health coming together. So thank you for the invitation to be here this morning, and thanks to everyone for their participation. I do have a few slides that I'll use to accompany my remarks. And some of you are very familiar with the strong accountable care community, and others of you may not be. So let me make sure that, can you see those slides on the screen, Margaret?
Yes, can see them, but you'll start from the first slide or whatever. Yep.
Yes.
Looks good.
All right. So the Strong Accountable Care Community is the organization that I've been asked to lead as director starting in March. And this is a bold undertaking for our region. And whereas much of the conversation this morning has been about COVID relief and response and recovery, what Strong is about is more longitudinal, long-term investments in setting the foundation and creating the conditions by which our region can improve health and well-being and quality of life. So STRONG is an acronym that stands for striving toward resilience and opportunity for the next generation. So it is that forward-looking, long-term investment strategy. Over 300 organizations have been involved in the planning starting about 2 years ago throughout both Northeast Tennessee and Southwest Virginia. And we're focused heavily on things like early childhood development, educational success, economic vitality. And ultimately, if we do those things well, we will see improvements in health and well-being throughout the Appalachian Highlands. So what is an accountable care community? That's kind of jargony for some, admittedly, but it simply comes out of a lot of research that has indicated or proven that if we connect those who are seeking healthcare with the ability to address their social needs, then we can improve health outcomes, lower costs, and improve health and well-being over time. So it comes out of that recognition. And so accountable care communities, and there are numerous of these around the country, pull together multiple stakeholders to address health from a community perspective, understanding that there are a lot of different determinants of health that impact our health and well-being, and that we need to address those systemically and in a coordinated fashion if we're to be able to succeed. So our community includes businesses, schools and universities, healthcare providers, social service organizations, faith communities, and many more. So it's a very diverse group that has been pulled together. And so we're really the only organization of its kind that's focusing so broadly on health and well-being and across our two-state region. We talk about planning regionally, acting locally, and that's very, very much the case for those who have joined our effort. And we think that as we come together and collaborate and execute programs and services with a regional plan, a common agenda in mind, that together we will lift the Appalachian Highlands as a region to new heights of health and well-being and quality of life. This is a quick glance at our structure, and we are blessed to have two great backbone support organizations, the United Way of Southwest Virginia and Ballad Health, a leadership council of 12 Virginians and 12 Tennesseans, including Margaret, who is a member, and also Lisa Lisa Kofer is a member of several of our working groups, and several other people on the call are members of working groups as well. But the Leadership Council is really the body to which I report, and the group that governs the activity of the Strong Accountable Care community. We have we're in the midst of a very important time as we pivot from 2 years plus of planning to now executing and implementing a strategic plan that is a bold and ambitious agenda to transform health and well-being in the region for years to come. So we talk about determinants of health, and notice in this graphic that on the left-hand side, only 10% of actual healthcare access contributes to health, but fully 50% is healthy behaviors, and 20% genetics, 20% environment. So the Strong ACC is working on that 50% in healthy behaviors, and also in some cases the 20% of environmental factors that impact health that we can change as well. So out of the 2+ years of planning by this cross-sector group of organizations, they came up with 4 priority areas to address over the coming years. And notice at the bottom, childhood trauma and resilience. That is an area that's getting a lot of focus and attention, and I think rightfully so, because so much of the adverse health outcomes that take place are the result of unaddressed childhood trauma that, had we acted differently upstream, could have been prevented or mitigated. So we're expending a lot of energy and focus right now trying to set the stage for improving childhood experience, reducing adverse childhood experiences, and setting young children and families on a path to resiliency and self-sufficiency. A part of this focus is being helped with the release of a documentary film that we are pleased to be screening very soon, called Starting at Zero, which actually takes the latest of brain science and talks about how in the first 3 years especially, the brain is so impacted by experiences, and if that young child is exposed to toxic environments or toxic experiences, it really does impact and shape the brain for the rest of his or her life. And so we need to, as a country, invest in programs and supports that help families with young children get off to a great start in life and be better able to be on the path to success in the future. So stay tuned. We'll be announcing this screening very soon, and would love for anybody who's on this call to be able to view it. It'll be hosted and available through our website at strongacc.org. So stay tuned for further announcements about that. So here are the 4 projects that we've taken on this year from the 17 that are in our 4-year plan. So these 4 are underway as we speak. We've got a regional data dashboard that is the first of its kind that is now posted on the Strong ACC website. You can go there now and see what is there. It is intended to be a resource for anyone in the region who's working on health and well-being and education and economic development, to be able to go and look at our 2-state, 21-county region on a county-by-county basis and see how we rank in terms of a variety of indicators and metrics. And so we expect that grant writers, program planners, and administrators will use this, and ultimately the region will benefit from having this data at their fingertips through our website. we're going to be, I'll share a couple of screenshots to show you what it looks like in a second. We're also implementing something very exciting called the No Wrong Door Initiative, which is a system that will link healthcare and social service providers through the use of a robust community referral technology called Unite Us. I'll say more about that in a second. Then we're doing training primarily targeted to school divisions, public school divisions, primary and secondary schools, to bring their staff, teachers and administrators up to a common level with regard to adverse childhood experiences, trauma-informed education, mental health first aid, and resilience. There's been some training provided in the region within the public schools around this. We want every school division in the 21 county region to have a basic level of understanding as a first step. And then next step will be to help educate teachers who are dealing with students every day in the classroom to have the skills that they need to address situations when children may be acting out or exhibiting behaviors that that they need to be able to address in an effective and healthy way, rather than a punitive way that often is very counterproductive and can lead to very adverse outcomes. So there's a lot of work that needs to be done, and we're committed to that, working with school divisions around the region. And then finally, providing life skills, soft skills, and workforce training opportunities, working with all of those organizations that are engaged in that to better prepare our workforce, both young adults and youth, to be prepared to be able to compete for jobs, keep those jobs when they get them, advance in their career, and have the necessary skills that will help them to do that. So here are a couple of screenshots. This is one screenshot of our regional data dashboard, so you just get an idea of the power of this tool. This is a view of one of the health behavior metrics, specifically adult obesity, again, by county. And the lighter shaded counties have lower rates of adult obesity, while those that are darker shaded have higher rates. And so this gives those who are planning or delivering programs and services an opportunity to target areas of need and to, over time, be able to see, hopefully, reductions in those adult obesity rates that would indicate that we're getting the job done, or we're not, and we need to dedicate more effort and resources to it. So these are point-in-time views with the latest data from the latest data available. We hope to build the trend data over time into this so that we can look not only at point in time, but year over year changes to be able to see if we're improving or not, and if so, what we need to do to address that. Here's a view of teen births by county. And again, lighter shaded counties have lower rates. And so there are a number of different measures and indicators here. It is initially very health focused. We expect over time to add more education metrics, as well as economic development and workforce metrics, so that it'll be a comprehensive view for planners and program developers and administrators to be able to, within their organizations and acting collaboratively with others, address some of these issues. I mentioned No Wrong Door, and this is truly a potentially transformative initiative for our region. Unite Us is a company that was started in 2013 by a couple of veterans who came out of the service and attempted to help their buddies who needed support, and found this incredibly fragmented service delivery system. So they said, we can do better. So they put together this online technology platform to automate a lot of the community referral workflow to make it a closed loop and much more efficiently and effectively help organizations track and manage referrals. And they were amazingly successful. They got some venture capital funding and said, we ought to do this not just for veterans, but for any organizations that's trying to help those in need. So they have now been introduced in 40 states and 85 different communities. And it is an amazing technology. So we are just now launching this. The United Way, Lisa Kofer, the United Way of Bristol is one of the early adopters of this. Healing Hands Health Center, I saw Helen Scott on the call, is another early adopter. We expect and hope that literally hundreds of health and social service providing organizations across the region will become part of this network over time to enable us to much more efficiently and effectively handle referrals when people are in need. And so for the faith community, many churches and congregations work with intermediary organizations to help those in need. And I know that you have some of those in the Bristol community and throughout Sullivan County and throughout the region, and they provide a great service. We want to help those organizations be able to tap into this technology so they can much more effectively help those in need and get people the services that they need much more quickly and effectively. What can your faith community do? Well, we would love for you to join the Strong ACC. We have churches that are members, including in Sullivan County and the city of Bristol. We'd love to have more. Of course, having been a pastor myself and led congregations, I think there's a great opportunity to create a culture of health through a variety of different ways that you can do that. I've listed several here on the screen. Creating or joining ministry opportunities to come alongside those who are helping neighbors in need is a great need and opportunity. Hosting events and programs and services is also an important opportunity. You've heard mentioned the opportunity to host a COVID vaccine clinic. Great concept. Another role that I think faith leaders can certainly play is by encouraging members of the congregation about the importance of being vaccinated to keep the community safe and their families safe, and to reduce some of the vaccine hesitancy that we see and need to overcome. I'm happy to come and speak to your congregation. I've been known to preach a sermon here and there. Would love to be invited to come and speak and give a presentation, perhaps even do a guest sermon to your congregation. And then we'd love to see you and encourage others to join the Strong ACC. We're all in this together. We believe the faith community is so important. You have so many things that can contribute to the community's health and well-being. You have physical spaces. You have people who care, and you have a mission to serve those in need, the sick, the widow, the orphan, and those are things that are not easily found elsewhere. And so those are some of your greatest assets, and we believe that they can be greatly used, mightily used to support and accompany and complement others who are doing helping needs in your community. So I believe greatly in the power of the faith community to be a part of our long-term health and quality of life here in the region. So thank you so much for giving me a chance to give an update. This is my contact information. Please don't hesitate to reach out. I'd love to to come and meet with you and get to know you, and hope that we'll have an opportunity to do that soon. Thank you so much, Margaret, and happy to answer any questions.
All right, folks, what questions do you have? And I did answer one in chat, Mark, about why the city wasn't listed on the data, and I think that's been a glitch that y'all are working on. So the technology, you got to love it, right?
Being a native of Virginia, that was one of my first questions too, of the people who were putting the dashboard together, because I know that cities and counties are different animals in Virginia. And what I have found, Margaret, is in fact, many of the data sets or sources for these present indicators and metrics only capture the data by county and not by city. So it's entirely lacking in some of these data sets, which is problematic for us in Virginia, who have separate cities, and we have the cities of Bristol and Norton in our footprint. So I'm stymied by the same question, but believe me, whenever the city data is available, we will make sure that it is included.
Well, I'll say from Tennessee and working in nonprofits, et cetera, we are always envious of Bristol, Virginia to have their own data as opposed to being lumped in with the whole county and not being able to see our own community. So that's plus minus along those lines. Who else might have a question for Mark? And I will say, so I'm looking at Ellen's response. I will say that's quite an offer to do some sermons and church visitations. So it is summertime and people are out of town, coming back from being out of town. Might take you up on having you do a Sunday at their church with their congregation. I love that. So other questions, comments from anyone? It's very exciting what we're seeing with this, and you know, COVID certainly has many negatives, but there are positives with funding that's coming into our community and opportunities. The Ballad initiative and accountable care community, it began before that time. And it is huge opportunity for building our capacity as a region, as a community, for building on our collaborations, and having the tools to be able to do that is pretty phenomenal. But it is up to us to utilize those tools. They're only as good as as the users who put the information in or who join, et cetera. So that's critical to have us doing that work as well. Also, I'll note that those resources that our congregations provide are great. We know a lot that early childhood is work that's done every Sunday, if not preschools and childcare centers. We, meaning those of us who are talking about ACEs and trauma and resiliency, would love to talk to your congregations about trainings, about opportunities, because it is so critical. Also, everybody's in the business of family supports. So looking at how, and that's what today is also about, how we can support families in congregations and in our communities. Also, just a note that with all of this work and with addiction, with recovery, with resiliency, relationships are probably the number one, the most important. Mentoring, and it's mentoring children, it's mentoring folks going through hard times. But we all know that mentoring is critical to all of us, and that's certainly where that can come in from our congregations and that caring community as well. And starting at 0, we hope at Bristol's Promise, and y'all could do the same thing as well, but we're hoping that we will do a showing on Zoom through Bristol's Promise, and where we can introduce it and have some discussion afterwards. So I think that opportunity will be available during, I think it'll be a week or so that it'll be online available. So watch for that, and hopefully enough lead time where people can plan an event if they would like to have that, since watching it on our own is one thing, watching it to be able to talk about it together is quite another opportunity. Okay, so I think for our last on the agenda, Eric Fields was unable to be here today. Are you waving goodbye, Tammy, or you want a question? She's waving goodbye. So we have a resource that has been worked on prior to the Accountable Care Community resources. And we have 211, and I know Carissa South is on here from 211, which has been available both in Southwest Virginia and in Northeast Tennessee for resources. You can find it online, you can dial it. But the summit took that to another layer and has a website called servingtricities.org. And Melissa was there is now a video on how to use that resource, but Melissa was going to just talk briefly about it. Bristol's Promise has supported that development of that resource. Particularly, it was sped up during COVID to help with response. So Melissa, you want to talk to us just a little bit?
Absolutely. Thank you, Margaret. And I'm going to go ahead and share my screen. I've got the website pulled up. I wanted to show you all what it looked like. So you can see this is the servingtricities.org website. It is live, so you are welcome to check this out. You can search by programs or see the full program list. But the great thing about this is here are some of the links that you might find useful. It has a child care finder for both Tennessee and Virginia. You can look for programs that serve people who are experiencing homelessness, veterans, formerly incarcerated, expectant mothers. You can search by goal, which is really novel in the way that things are done. If your goal is to have good physical health, if your goal is to have stable housing, you can search resources by those goals or by what you're currently experiencing. So you can search because you're currently experiencing substance abuse issues or suicidality or a crisis pregnancy. And then you can look for programs that offer things like after-school programs, baby supplies, educational services, those types of things. So it's a really novel way of being able to search. It's not just, okay, I'm hungry, I need food services. It's this is what I'm experiencing, or these are my long-term goals. So you can use the links below to look at the different directories by program, by organization, by community resource. There are lots of different ways to access this information. And again, there's been lots of work done with 211 to not, duplicate those services, to cross support. And 211 largely is the easiest way to pick up the phone and dial 211, and that's a warm line. So you're going to get somebody who can talk to you, who can do light crisis intervention, who can refer you. But there are lots of people out there who don't necessarily want to talk to somebody. That might be embarrassed. They might not really know what they're looking for. And this might be an easier way for them to start that process. For those of you who have programs, and again, we've talked about our faith community has things like support service programs, you have things like grief services, those types of programs. We encourage you to add those programs to this resource. And you can go up here and register as a provider. And it will, if you want to submit a program, you can do that. And then you'll get a login. You can fill out the hours, the days, the times, any cost, whether it's open or virtual, all kinds of things. So I encourage you all to check the website out, and to register your program if you haven't done so already, because it's just like Unite Us. You know, Unite Us does that case management, making sure that nobody falls through the cracks, but it's only as strong as people using it. And Serving Tri-Cities is very much the same way. It's only as strong as making sure that the programs are in there. So we want to make sure that people have access to resources that they need in their times of need. Any questions about servingtricities.org?
So it is a great resource, and I was going to go ahead and post, the training video in, and I think that they may be changing it a little bit, but it's available as well. And we will share with you guys everything that was provided in the chat. We will do a follow-up email with the recording and things that are in the chat as well. So, so any questions about the servingtricities.org or any of the other resources that, or any of the other discussions we've had? I would note that we have a lot of folks representing resources on here. For those of you faith folks that have been involved with Family Promise in the past, we're going to be doing some more updates, but we're very excited to have a grant that enables us to provide a lot of assistance. And also in conversation with the National Family Promise, this is direction that lots of communities are taking their programs as well. So,
and I do want to offer another resource through Bristol's Promise. If I can take just a few minutes to talk about that. Mark talked about adverse childhood experiences, and we throw that term around as if everybody understands what that is. But what that means, there are long-term toxic stress events in a child's life prior to turning 18 that we know can have lifelong negative health outcomes. It increases the chances of cancer, heart disease, inflammatory disease. And these are things like parental divorce or substance use disorder in the household. What we're looking at now, and what the Journal of Pediatric Medicine is looking at, is, does COVID count as an adverse childhood experiences? As an adverse childhood experience. It is a long-term high stress event. And there's early studies that say that that is going to contribute to those potentials of lifelong negative health outcomes. But the good news is that resilience, which offsets those negative health outcomes, can be built across a lifetime. And so Mark talks about brain science. One of the programs that Bristol's Promise offers is Building Strong Brains, which talks about how a brain is built, how toxic stress can alter that building, and how resilience can be built across the lifetime. So we know that our children are undergoing this stress. You know what the school year has been like. You know how they've been back and forth, watching the news. Kids see more than we think they do. But we also know that trauma is in the room, right? That mom and dad or grandma and grandpa caretakers, that they may have had adverse childhood experiences. And so we offer the Bristol Connect Workforce Sustainability Program. We have several business partners where we go into that business and provide services to those workers, whether they need help finding food, whether they need help finding childcare, whether they need somebody to talk to. We have somebody on site who can help them. Currently, both Strongwell and Robinette are two of our business partners. Bristol, Virginia Public Schools is another one. And then also Appalachian Sustainable Development is one of our partners. They are doing a career readiness program for people who have barriers to employment. And so Mark talks a little bit about that essential skill building, those people who might have barriers, and Appalachian Sustainable Development is doing that program. So if you want more information, we encourage you to reach out. The other thing is, if you want specific ways to improve the community to build resilience, we encourage you to come to our trauma responsive care community meetings. We hold these meetings every other month on the third Thursday from 10 until noon. And we talk about ways that we can improve the health and well-being of our community through a trauma responsive lens. So those are just a couple of the things that you as the faith community can do, is get involved in the trauma responsive care community. It is the entire upper 8 counties of Northeast Tennessee. Danielle Dye with United Way of Southwest Virginia holds and trusts Southwest Virginia. So there's lots of overlap and coordination between the two of us. But, get involved in those and find out how you can help support building resilience across a lifetime for all of our community.
Thank you, Melissa. And yeah, if you want more information about any of this or how to get involved, the housing situation, to try to get involved in figuring out what are our solutions to finding and providing more both affordable housing as well as housing that is affordable. If you have folks in your congregations who are landlords who would be interested in trying to work to see how we can work together, let us know. So Melissa and/or your email came from Melissa. She can give your information to the right person to find your spot. Same for the early childhood, and part of our Bristol's Promise programming is parenting. That's the first child care step, is parents are parents forever, and no matter what or whoever is parenting those children, that starts at day one. And we are bringing together folks who are working on parenting education in the region, working in that area as well. So if there's any of these areas y'all are interested in pursuing as a congregation, or for us to work with, we would greatly welcome your reaching out to us. We want to be here. We want to be helpful. For follow-up, we have talked whether it would be helpful to have a session just focused on resources and have opportunities. There's lots of folks who are on here who are fantastic with what they provide in the community and could share a lot more about what their programs are and how you can reach them. So we have talked about that. We would love any of your feedback for how this is helpful or not helpful, and what else you would like to see. That would be fantastic. We may include that when we do a follow-up email as well. Does anybody, and I'm going to ask Mark Cruz, take a minute to think, because I'm going to ask you for a benediction in a second. So does anybody else have any other questions, comments, anything they want to add before we end for today? Lynn,
I do. I'm Lynn from the Housing Authority. We've mentioned the Envision Center a couple of times, and I just wanted to give a little update there and say that our Housing Authority is applying for rental relief on behalf of our residents, applying as landlord. The Envision Center is helping landlords. So if you do know of landlords who are having trouble collecting rent from their tenants, we are able to help. I put the number for the Envision Center in the chat. You can call there, and we are more than glad to help work that through. It's not a terribly easy process, but it can be done. And that's, people in trauma getting their bills paid. That's a big deal. And the eviction moratorium was continued for another month. So we want to make every opportunity to help folks to access those funds to keep them current so that they can remain housed. We're looking for the floodgates to just open, and homelessness is going to be a bigger issue coming end of summer into the fall. So anything we can do now to kind of help keep people housed, we want to do that. And we're happy to help at the Envision Center. So we also have a new recovery group that started meeting there last night. They're meeting on Monday nights at 8 o'clock. It's from The Table. It's a group that's meeting at the Boys and Girls Club on Sunday evenings. So it's a faith-based recovery program that'll be meeting at the Envision Center at 8 o'clock on Monday evenings. Zach Colt is leading that program, and he would be happy for you all to plug anybody into that would need that support. So
Okay.
And one more quick thing. At the Housing Authority, we are kind of changing how we do business. We've been designated a move to work agency, and we want very much to change some of the policy. This gives us an opportunity to change decades old policy, right? And to do business in a real different, innovative way. We want to become a resilient community. And the changes that we make, we want that to have a positive impact on our residents and help them to become more self-sufficient and stable. That's our goal. So we are putting together a survey that we would very much like to have your input in. So when we get that finalized later today or first thing in the morning, I'm going to send that to Melissa and ask if she will send that out. And then if you guys wouldn't mind to click on the link and participate in that survey, it would be very beneficial to us as we move forward. Thank you. That is all.
Okay, and just so the three biggest umbrella for housing, for United Way is a great number to call if you need referral help, whatever, so they know the resources.
They are sending those to the Envision Center, so you can call the Envision Center.
And also the Envision Center, and also Family Promise of Bristol.
Sure.
So Envision Center can serve Tennessee and Virginia, but it depends on their funding for which programs they can do. And the same Family Promise right now has Tennessee money, so they can serve Tennessee, but it's an organization that crosses the line. So we have some great organizations. They know the resources, they can get you to the right place. So those are the three big ones, as well as serving Tri-Cities. So to get pointed in the right direction and to help folks out. So, okay, anybody else? And then I'll call on Mark Cruz. If you could, we'll call on you with your divinity degree skills and ask you to do a benediction for us.
Thank you, Margaret. Would you pray with me now? Thank you, Lord, for this beautiful day, for the sunshine and the warmth that these days bring, that give us a chance to enjoy the natural beauty and surroundings that you have created. Thank you for the fellowship that we have enjoyed this morning of kindred minds and souls and spirits, both professional and personal, coming together to understand more about what is happening in our region, to explore ideas and strategies for helping to make life better, especially for those in need, and for seeing the possibilities that exist for us to work together and to realize a better life for our community and our region. Continue to grant us wisdom and strength as the pandemic winds down, as we continue to face certain threats from the Delta variant, as we work to help communities and individuals overcome their reluctance to vaccination, as we work to provide opportunities for people to get the vaccine and encourage them. Let us not grow complacent, but help us to be vigilant and help us to be mindful that the pandemic isn't over, that we need to be smart and we need to help others to act wisely and to keep themselves and their families and their communities safe. Grant us continued strength and wisdom as we serve those communities and individuals who you've placed in our path to serve. Help us to take good care of ourselves, to take the necessary time off to refresh and to regenerate and recharge, especially during this time of the year, so that we can come back stronger and more resilient and inspired and ready to tackle the challenges ahead. Thank you for all those who've been able to participate in today's call. Thank you for what they bring each and every day to their work, and for the ways in which they do their work and interact with others. It is such a blessing. and we need to always be grateful and mindful of it. Bless us as we go on for the rest of our day today, and enable us to come back together again next time safely and in good health. And it is in your name that we pray. Amen.
Thank you very much. So thank you to everybody, and we will be in touch. So thanks.
Okay.
Thanks.
Thank you. Bye.